Next, I'd like to ask Dr. Folsom is filling in for Dr. Polsky today to give us an update on the COVID situation. So welcome, Dr. Folsom.
Thank you. Thanks for allowing me to pinch it.
Absolutely.
And may the 4th be with you for all those Star Wars fans out there. I'm sorry. All right, so for the Calvert County COVID update from the Health Department, this is a regular slide that you all see. We did see a slight downtick in our Calvert County COVID-19 cases this week, down to about 130. And a positivity rate has decreased as well, down to a little over 6%. Again, the goal from the CDC would be less than 5%, but ultimately we're getting there. We did see a slight uptick in our 20-year-olds and our 50-year-olds with a commensurate decrease in our youth, which is fantastic to see. We still see relatively low numbers for our 65 and over community, which is fantastic. Our COVID testing data shows that we have seen a slight uptick in those who have been tested. A little over 2,200 people have been tested this past week, again with 135 cases and a positivity rate of just over 6%. Just keep in mind, again, that less than 5% is the goal for low transmissibility in the county, but we are slowly getting there. Shifting gears to statewide numbers, as Dr. Polsky typically shows, we did see a little over 6,000 cases in the state over the past week, with 100 deaths total. That equals about 14 Marylanders dying per day of COVID-related illness. Current hospitalizations across the state equal a little over 950. With over 250 people in the ICU. Currently, our contact at the hospital did just send me a line list today, and we have 4 people currently with COVID who are in the hospital, 2 over 80 years of age and 2 in their 30s. So very disparate age groups that are currently there. No ICU admissions currently for COVID, thankfully. Switching gears to COVID vaccination. So on this slide, we know that this is a very busy slide that we get sent from the state, but you can see that Calvert's, I think, the 5th or 6th line down there. The good news is that we are vaccinating people at least the rate of the state, if not better. If you look at our adult population, we actually have a percent at about 56% for having received a first dose vaccination. So that's impressive at this point in time for all adults. And we just sort of want to keep in mind that at this point, although there's a lot of news coming out that we're going to get younger people vaccinated, it still is, we're waiting for the FDA to have their regular meeting this week and everything before we can make any decisions about that. For those 65 and over, we've got a great rate. We're the second in the state behind Howard County, which always surpasses everybody on every health metric in the state. But we are second in the state with a little over 77% of our seniors vaccinated, which is great. Just a reminder that local and mass vaccination sites continue to have vaccines on hand, as do pharmacies. Multiple medical providers in our community have been provided vaccinations. I still think, as a former practicing family doctor in the community for over a decade, the best place for people to get their medical education is from their own personal physician, who can know their medical history and guide them as to where they should get their vaccines and what type of vaccine to get. There are still options to get it at mass vac sites and at our drive-through as well. As Dr. Polsky mentioned last week, the calvertcountycovid19.com website is now fully operational. You click on the Go Vax button, scroll down a little bit, and you see the first and second open public links. So you can click on those and register yourself at that time. We are no longer requiring that somebody wait for a link to be sent to them. They can just go online and get signed up for our site. We also have partnered with the school system and the hospital to do high school vaccination clinics this week. So we did Patuxent High School yesterday. We have set to do Northern Calvert and Huntingtown High Schools. So there'll be a little over 400 16, 17, and 18-year-olds vaccinated with their parents' permission through the school system. And we felt that this was a good option for them in terms of getting there, getting the vaccine, and getting covered. So any questions?
So those students, they can only receive a Pfizer vaccination?
Yes. The hospital and the health department put together a request to the state on 2 sequential weeks, basically asking for more Pfizer allotments. So we were able to secure Pfizer last week. The school system moved pretty rapidly to create some clinics there, staffed essentially with their school nurses. And then the emails were sent out so that parents could consent to their children being vaccinated on site. Those clinics are running 1 to 5:30ish every day, so that it allows for those kids to get vaccinated before they head home for the day. It is available to virtual learners as well, so it's not just for kids who are in cohort A, cohort B, or in face-to-face instruction.
So if your child is at home, all you have to do is register.
Yes, so you should have gotten a link from eSchool to your email. And there's a little link on there that you should be able to click. We will be running some Pfizer clinics in the weeks to come, we suspect, at our drive-through. But that remains to be seen based on our uptake through the hospital.
But if we have homeschoolers, they
Yes.
may not get that link.
So they actually were offered, along with Calverton, because Calverton obviously still has some kids in that age group. They were offered vaccination through the hospital last week, but we will have open registrations for Pfizer vaccine for anybody who didn't get in that clinic.
So this week, did you have enough vaccine to do all the students that requested it?
Yes, we have ample supply for Pfizer vaccine. We have a little over 1,000 total doses for the county that was provided to us, and we have a little over 420 students signed up for vaccination at this point in time. So it's fantastic.
So are they projecting to give you more Pfizer next week?
We've requested
Following week?
more. Yeah, Dr. Polsky actually sent in his request. He has to submit it by Tuesday every week. But he requested more Pfizer. So hopefully we get more of that. And with the potential for getting 12 to 15-year-olds approved in the near future, that might be something that we need to sort of encourage in terms of getting that Pfizer into our county.
So if someone were to register today,
Yes.
when could they get an appointment to get a...
May the 6th is the next open public link. So that's 2 days from now. So they'd get their first dose on May the 6th. And then their second one would be 28 to 42 days later. They do have to sign up for both the first and second doses on that public link.
So are we at a point where we have enough vaccine to
Yes.
do everybody that makes a request?
Yep.
So there's no wait,
Yep, no wait.
basically.
And if they call the health department, our staff knows to sign them up too. If they have difficulties with internet access or connectivity, they can call the health department at 410-535-5400 and ask to get signed up. So everybody there is willing to help assist.
So I assume that we're going to ramp up outreach.
Yes, so we are in talks. We already talked with Kathy Maney with the Chamber of Commerce about potentially doing some mobile outreach at various businesses in the community, both in the south and northern ends in particular, since our drive-through is centrally located. So some of those people that are working long hours during the day might need someone to sort of be there at the opposite ends of the county. So we're working on that. Kim Long is one of the people that works for our homebound citizens, so she gets regular requests to go into the home and give them vaccinations. So those people are already sort of on our list to do vaccination outreach efforts.
Commissioner Hance,
Yes.
Communications is also working with the health department to actively promote that. Okay.
Right, because, the previous problem was we didn't have enough vaccine.
Yes.
So,
Yeah.
it's hard to advertise for people to
Yes,
come in. But
exactly.
now we're getting to a point where we're going to have plenty of vaccine. So it's to get the message out that it is important.
Absolutely. And most medical providers that have had vaccination in their practices have also seen that they've sort of hit that sort of standpoint where all the people that were very eager to get in, and now it's about, some of my old colleagues have been able to sort of talk with their patients and say this would be a wise decision for you. And so it's helpful to have the doses in their offices as well. So any outreach that we can do to help is what we would like to do for sure.
Right. And there shouldn't be any reason to drive to Waldorf or Baltimore anymore.
No. And in fact, we're trying to work with some people. The other big group that might become one of the outreach groups will be kids arriving back from colleges. And so they may have received their first dose of Pfizer or Moderna at their college, and they'll need to get their second dose here. We should have ample supply to be able to provide that for them. So we'll work on those second dose clinics for that age group as well when they come back.
So I had a email from a citizen this week that said at a certain facility,
Yes.
several staff members had tested positive. And
Yes.
they relayed that a request had been made to retest those individuals just to make sure.
Yes.
And that was declined. They were just stuck in this 14-day quarantine, and
Yeah.
they didn't understand why there wasn't more willingness to retest those individuals just to be sure
Yeah.
to not have to go through that. So
Yeah.
can you talk about that?
Yes. So whenever there's a technical outbreak, we actually have to report it to the state of Maryland. An epidemiologist up at the state actually is the one who dictates repeat testing. 2 of the people have genetic sequencing pending at the state level. So we're trying to look to see if there are variants and that, as it pertains to that particular situation, which would make more sense as to why these people would be testing positive. But a lot of this is dictated at the state level by a state epidemiologist. And the parameters for 14-day quarantines sort of is across the board for all nursing homes at the state of Maryland. So we don't have much discretion in terms of that. They are all PCR tested. So it's not just a rapid test, and kind of going by that. So they should be getting PCR testing. Yeah.
And it's also important to note that once you get vaccinated, you still can get COVID.
Yes.
The people under a conception that once I get vaccinated, I can't get it.
Correct.
But unless I'm wrong,
well, with the
you can still get it, but
Right.
it reduces the impact that it has on your body. It should keep you out of the hospital, and it should keep you from
Yes,
dying
exactly.
from
Yeah.
COVID.
So with a 95% effectiveness rate, which is what Pfizer and Moderna have, for every 1,000 people we vaccinate, we'll see 50 people test positive after full vaccination. But those people will be less likely to go on to be hospitalized in the ICU and die of COVID, and likely will decrease their transmission rate to other people in the community, which is also what we're going for
So
for those members. Yeah.
we should not be shocked when somebody that's been vaccinated tests
Nope.
positive for COVID.
No, sir, we should not. Yes.
We shouldn't.
And please get tested if you have symptoms.
Right.
We have ample testing supplies, so please get tested if you have symptoms for sure.
Correct.
Okay.
I think
Mr.
I'm out of
President.
question. Commissioner Hutchins.
Yes.
Yes, Doctor, once again, the emphasis in short then is get vaccinated, continue to practice the CDC guidelines, irregardless of whether you're vaccinated or not, correct?
Correct. And let's get back to normal.
Okay, and that's the line to put forward.
Yes, absolutely.
Thank you.
Yes, thank you.
Whatever that normal is going to look like.
Whatever it's going to look like.
That should be a bumper sticker. Let's get back to normal.
A T-shirt.
We'll put it on our next social media, all right? Any other
All right.
questions?
I don't.
Doctor, thank you.
Thank you
you're
so
welcome.
much.
You're welcome. It was a pleasure. All right.
Maybe
very
when Polsky comes back, you can just tell him to stay in his office. And
good. Sounds good.
you can come anytime.
Thank you very much.
Thank you.